Hello, and welcome to the latest video from Adolescent Medicine Consulting. I am Dr. Mira Bihari, a pediatrician and board-certified adolescent medicine specialist with over 20 years of experience caring for teens, tweens, and young adults. I started Adolescent Medicine Consulting to help physicians and other healthcare team members learn more about adolescent medicine so we can all help teens live happier, healthier lives. These videos are one of the many services we offer. Please check out our website, www.adolescentmedicineconsulting.com, and send us a message for more information about how we can help you help teens. Now, let's jump to the video. As the holiday season gets into full gear, here are some ideas to help the teens and young adults in your life stay safe. These talks are intended for healthcare professionals, but I think this one is useful for everyone. As a reminder, these videos are for educational and informational purposes only. They are not a substitute for your own clinical judgment and do not constitute a medical consultation. Ideally, you want to have a conversation about potential risks before they arise. Find a time for you and the young person to speak in a neutral place when you are both calm. Remembering that the emotional center of a teen's brain is more active and quick to react, it's very important that you keep your cool and take breaks if things get heated. Use some of the questions that we shared in the earlier videos to find out what they already know about drugs and alcohol and how to stay safe. Do they know that one pill can kill? Do they know that sometimes people slip alcohol or other drugs into drinks? Do they have a designated driver that can be trusted not to drink and use drugs? When I speak with teens in a visit, I ask them to develop a plan with their parent or other trusted adult to help escape difficult situations. For my patients with eating disorders, I help them develop a phrase to politely escape high-stress holiday situations, like a loaded buffet table or a family member who makes comments about other people's bodies. In party situations, it might be the teen sending a message like, "I forgot to take out the garbage," to let their parent know that they need a pickup right away. We also want to make sure that young people are prepared to handle situations that may arise for themselves or their friends. As difficult as it may be, let them know that if they're intoxicated, you want them or their friends to call you or 911 to get help right away. Alcohol poisoning is real and potentially deadly. The time to discuss punishments for breaking any rules is when everyone is calm and fully sober, not during the crisis. If they engage in unprotected sex, it's important for them to get tested for STDs and pregnancy soon after. Emergency contraception is available over the counter or as a prescription. Having this on hand before you need it is best, as many pharmacies close early during the holidays. If a sexual assault occurs, it's best to go to an emergency room with a trauma response team. They will have the appropriate staff and training to collect evidence and document injuries. The person who has been assaulted may be in shock and may not want to get help right away. Do everything you can to gently encourage them to go. If they still don't want to go, document any information they share, take pictures, and collect their clothing to preserve evidence. Knowing about supplies that can prevent problems empowers teens and their parents to stay safe. In the interest of time, I won't go into the details of these products in this video, but I am happy to further discuss them in one of our free monthly Zoom sessions or in a one-to-one. Check the text box accompanying this video for details about all of these options. I do not receive any compensation from any of these product manufacturers. Things that I recommend teens have when they head to a party are condoms, internal and external, Phexxi, a non-hormonal vaginal gel for pregnancy prevention, and Narcan or Cloxado, nasal naloxone to help reverse an opioid overdose. Phexxi currently requires a prescription. Condoms, Narcan, and Cloxado are available over the counter. It might be worthwhile to keep these items on hand if you're hosting a party. If unprotected sex happened, emergency contraception can help prevent a pregnancy within 3 to 5 days of the event. Levonorgestrel 1.5 milligrams is available over the counter under a few brand names. Plan B One Step is the most commonly known brand, but other brands such as New Day and My Way contain the same medication. Levonorgestrel for emergency contraception is most effective the earliest you take it after the unprotected event, ideally within 72 hours or 3 days of the event. Ella, ulipristal acetate, is available by prescription only and is available and effective for up to 5 days after unprotected sex. I like to prescribe it in advance for my patients who are not on a consistent method of birth control. If your patient already has birth control pills on hand, they can use the USP method to make a dose of emergency contraception. An IUD can also be used as emergency contraception. The main barrier to getting an IUD for emergency contraception is access to trained healthcare professionals who can place them in the 5 days after unprotected sex, especially around major holidays. One thing I have not talked about in a while is coding. This recently came up in a conversation with one of my viewers. Thank you, Cassie. So I am adding a slide on coding. For the topics in this video and the counseling topics that we discussed in the What to Do 1 series over the past several videos, you can use preventive care counseling codes to document your efforts in educating and advising your patients. The codes for counseling for individual patients are 99401, 99402, 99403, and 99404 for counseling in 15-minute intervals starting at 15 minutes for the 99401 and up to 60 minutes for a 99404. If you're doing group counseling, the codes are 99411 for 30 minutes and 99412 for 60 minutes of counseling. You can also use Z codes specific for counseling and prescribing emergency contraception. Always remember that billing information may be seen by the policyholder. I'm not a coding expert, so please double check with your practice's billers and coders to make sure that you're using the codes appropriately. Thank you for tuning in. As we move into 2025, I would like to hear from you. Leave a comment to let me know what topics you would like to see in an upcoming video. Thank you for tuning in to our video. We would love to hear your feedback and ideas for future videos. Please send us a message through this platform or directly through our website, www.adolescentmedicineconsulting.com. We look forward to seeing you at one of our free monthly Zoom sessions. These sessions are held on the second Wednesday of the month at 8 p.m. Eastern. You can get more info about the sessions at our website or in the text box accompanying this video. Thanks again from Adolescent Medicine Consulting, where we help you help teens.